Hi everyone, my name is Anton Draznin. I am a sports medicine doctor, urologist-andrologist, dermatovenereologist. I have been working as a doctor for 20 years. I work in the clinic Nauka in Samara city in Russia and at the same time conduct online consultations in sports medicine, urology, andrology and dermatovenereology. Recently, I have had a lot of patients of various ages and different social statuses with problems associated with low libido and erectile dysfunctions. Oddly enough, but nowadays, such problems are getting usual. How to help this man? Where to begin? And are there any prospects to solve these problems completely and return them to a normal life of full value? Indeed, even minor male health problems can reduce the quality of life. So, where do you start? Of course, in such cases, you should start with medical checkup, and further algorithm of diagnostic and treatment procedures will depend on the results of these examinations. The algorithm of such checkup is clear, and every professional andrologist knows it well and uses it in his work. It includes the following diagnostic procedures. Screening for sexually transmitted infections. This is the very first step you should take in order to solve such problems. Surprisingly, in some cases, just these infections play a huge role in such male problems. These diseases, especially those ones that presented in a man for a long time, lead to chronic inflammation, which in turn leads to low potency and erectile dysfunctions. This analysis should be done by PCR, polymerase chain reaction, for the detection of sexually transmitted infections. It is elementary at the moment and is being done worldwide. If any infection is revealed, appropriate treatment should be prescribed, and if it is the only reason, the problem goes away very quickly and the man feels completely restored. By the way, this is one of the most common reasons of low potency and erection, and it is really an easy to solve problem in case of correct approach. Then, ultrasound scanning of the organs of the scrotum and transrectal ultrasound scanning of the prostate. These two types of instrumental examinations also play a crucial role in the diagnostics of erectile dysfunctions, because the pathology of the prostate and scrotum organs is a direct way to low libido and any kind of potency disorders and erectile dysfunctions. Of course, I understand that these examinations are unpleasant and expensive, but you can't do without them. They are very informative in such cases, and revealed deviations are an indication for mandatory treatment by an appropriate specialist. Checkup of the hormonal system, hormone blood tests. This is the next important step in the diagnostics of such male problems, and in many cases it is the key one. Hormone blood panel includes not only total testosterone. There is a clear list of hormone blood tests that are required to be taken in order to study the hormonal system of a man. Total testosterone, free testosterone, sex hormone binding globulin, luteinizing hormone, follicle stimulating hormone, prolactin, and estradiol. Combinations of deviations in these hormones can be so diverse that it isn't possible to prescribe anything without knowing the specific case. Each specific case of such combinations is individual, and it requires an individual approach and treatment. It is common when men just simply start taking usual testosterone boosters in the hope of a positive result, but this approach is not correct and is very far from success. If everything was so simple. You need a professional specialist in order to understand these difficult combinations and get the right treatment. You should keep the correct algorithm of medical treatment in order to return to normal lab values. Then all the problems will simply disappear and you will begin living a full life, enjoying all the delights of your sexual life. Well, of course, you shouldn't discount social, economic, family factors, which along with physiological factors play a crucial role in the beginning of male problems: low libido, potency disorders, and erectile dysfunctions. To make it clear, I'll give a few examples. Try to imagine a man who has a lot of problems: financial, work, family. Is he up to sex in general? He's likely to have male problems, and he will immediately want to visit an andrologist. And in some cases, he can have normal lab values. If a doctor doesn't take into account his non-medical problems, he is unlikely to be able to help such a patient. Imagine another man who has certain problems in relationship and communication with his wife or girlfriend. Even if this man has no problems with male health, he may have difficulties in his sexual life. On top of that, in some cases, such men need help not only of an andrologist, but of a psychologist as well. Now, you see that the reasons of low libido, potency disorders, and erectile dysfunctions are really multifaceted, and the ways of solving such problems are actually complicated. Therefore, any attempts to solve these issues independently are not always a simple task. One should consult an appropriate specialist in order to deal with such problems perfectly well. Be healthy, live a full life. Dr. Draznin and Pharmagen Company are on guard of your health.